All right, everybody, let's get going. Everything good? Good. All right. Welcome, everybody. My name is Rob Puglisi, and I'm very excited to kick off this event tonight. Welcome to JeffSolves MedTech 2024. This is our final pitch event for this year's cohort. This is, hold on, let me pause the music. Sorry. This is actually our 9th year of the program, which is pretty wild to say. I'm very excited for our 10th anniversary next year. We're going to keep it rolling. And we're here today to introduce you to two amazing teams of Jefferson students who have spent over a year developing the concepts that are going to be presented today. And to give everyone an introduction to the JeffSolves program who is not familiar with it, JeffSolves is a one-of-a-kind program that brings together students from medicine and design disciplines to solve real challenges in health and healthcare. In this program, students work directly with mentors and end users from Thomas Jefferson University, Jefferson Health, Delve, where we are today, and beyond. And the focus for this program has always been to give students the opportunity to experience real-world problem solving during these essential formative phase or years of their career, where the skills they develop will serve them well as future leaders and change makers. The lessons ultimately that we hope our student will walk away with is that true innovation begins with empathy. Not to be driven by the newest shiny technology, although that is fun and extremely important, but most importantly, by the needs of those who we hope to serve. Today, just as in previous years, you'll see the efforts of the hundreds of hours that these students have put into this work, and you're sure to be just as proud of them as I am as they have approached the challenges before them. So, once again, we're excited to be a part of the Design Philadelphia Festival happening again this year that Jefferson is a sponsor of. Be sure to check it out online if that's not how you found us. It's an amazing series of events where you can see the work of amazing design happening all over this city, which we're proud to be a part of over the past few years and again this year. Welcome to everybody online. Wave to you on the camera. We have a great in-person audience today, as well as an audience online who is participating via Zoom. And for everybody online, we are going to have a question and answer period after each presentation. And if you'd like to ask a question, we have somebody monitoring the Q&A feature that you can access on Zoom. Now, this program would be impossible without significant collaboration and effort from many of the folks that you see on this slide here. Especially special thanks to Dr. Baker, our provost at Thomas Jefferson University, who is caught up in the ridiculous traffic that is out there. I'm sure there's another politician in town that's snarling things up, but he'll be here shortly. And I want to say a special direct thanks to my co-directors of this program who have been partnering with me for a number of years, Todd Corlett, Eric Schneider, and Becky Flax. Our program coordinator, Mary Ellen Daly, who we couldn't run this program without, certainly. And to our partners from Delve, Tom Dooley and Pat Brandon, who have been on this design journey with us for, I believe this is our 7th year. Now, importantly, I want to thank the many people who are almost nameless, essentially, not intentionally, but because there are so many who have contributed their kind of subject matter expertise and their lived experience experts and expertise to these concepts. We find that frequently folks will give their time and knowledge away just so they can see these problems that are so important to them move closer to being solved. So I want to commend the people who, can't be in the room with us, but were just as important in the framing of these concepts. Lastly, I'll say congratulations to our students. We've got 2 fantastic teams of students today. They are a mixture of medical students, industrial design students, and we have 1 textile engineering program student. Where'd you go? I lost you. There you are. Hi. Thank you, Anderson. And it really shows in kind of the work they've done, the power of bringing a multidisciplinary team together, and they've all exemplified what it means to be kind of open to collaboration in all of its kind of messy and bumpy ways that it works out, but it always works out better than if you work alone and in a vacuum. So, without stalling any further, I'm going to hand it off to Tom Dooley, Strategic Accounts Director here at Delph.
Great. Good evening, everybody. Rob, thank you again for the opportunity for allowing us to collaborate with you guys. I think this is our 7th year. Another round of great projects. So congrats to the students for getting your work done, getting your projects done. It's been great supporting you guys along the journey and seeing what you guys have come up with. So thank you again for including us. We look forward to doing this next year. And yeah, great work, guys.
Thank you. Thank you. All right. So bear with me for a moment while I pull up our first team's presentation. So our two teams, our first team is going to be Team Heal Up, followed by our second team, Team Commodore. Each team will be presenting for about 10 minutes, followed by a 5-minute question and answer period. And if you want to learn more about these projects and the projects that have come before them in previous years, you can find all the information about this program at healthdesignlab.com/JeffSolves. All right. Okay. How's it look online? Good. All right. Here you go.
Hi, good evening, everyone. Thank you for coming. My name is Samuel Leshmagun. I'm a second-year medical student here at SKMC.
And my name is Haig Manukin. I'm also a second-year medical student here at SKMC.
Hey, I am Mason Mayo. I'm a fourth-year industrial design student at East Falls.
Hi, everyone. My name is Rabiul Rafi. I'm a second-year medical student.
And we are Team Heal Up. So Heal Up is a modified crutch with a built-in leg elevation system designed to help those with lower limb injuries alleviate any pain they may have from swelling. But before we go into that, I just want to give a quick background story as to how the idea for the product came to be. So I was in my junior year of college and I was playing basketball with some friends when I ended up injuring my knee. So I tried to stand up on it and I wasn't really able to. So my friends had to call EMS in order to get me to the hospital. At the hospital, the doctor told me that fortunately I didn't tear anything or break any bones, but that I did displace my patella and I would have to be on crutches for around like 4 weeks. And in addition to this, they told me that I should try to rest, ice, compress, and elevate my leg in order to alleviate any pain I'm from swelling. So with that information and a pair of crutches, they sent me home. So at home, it was pretty easy to follow these instructions. I could just be lying down on my bed and then put some pillows to elevate my leg. Or if I was working at my desk, I can just pull up a chair and use that to elevate my leg. But yeah, problems started to arise when I had to go to lecture that following Monday. So I was in a lecture hall that looked something like this. And as you can probably tell by looking, there's like not that much there to use to help to elevate your leg. So about 5 to 10 minutes into the lecture, I was just in so much pain, like so much that I couldn't even focus on what the lecturer was even talking about. So this continued until I was able to find a random stool that was in the lecture hall to use to elevate my leg. And although I was able to use this stool to elevate my leg in this lecture, not all the lectures I had for the 4 weeks had some type of elevation device for me to relieve the pain I had from swelling. And also like the environments I found myself in didn't always have elevation devices. So it was an overall bad experience for me and just something I was like working to improve on. So fast forward a couple of years later, I joined the design track here at Jefferson through SKMC. And we were told to find a problem that we thought needed a solution. And immediately I thought back to this experience I had, and we've been working on this problem ever since.
Yeah, so Sam's case is not an isolated event. In the US, we have 141 million ER visits per year, and a whopping 15% of those come from lower leg injuries. many of which necessitate the use of crutches for long-term or short-term use. And one of the main problems that these patients report is leg swelling that comes with pain. And the idea behind that is pretty intuitive. The blood that pools in their legs are normally pushed up with the muscles contracting. But with these patients, they're either immobilized or unable to use those muscles. And as a result, that blood pools and kind of swells that area and those tissues. So the very simple solution to that is elevating the legs. And that kind of gave way to the framework for our project. So the framework involves someone experiencing a lower leg injury, and then they go to their provider, and the provider prescribes them crutches. And here we kind of see the problem that Sam briefly spoke about in his experience. When this person is sitting down somewhere where they can't elevate their legs, they experience pain associated with that swelling. And that brought us to our question: how can we help this patient elevate their legs in a very convenient and efficient manner?
So, like I said before, I used like a chair when I was at a desk in order to elevate my leg, and that was effective. But you're not always going to have a chair in every environment you find yourself in. So, like, let's say, for example, like a bus stop. So, although it was an effective solution, it wasn't really reliable. So, our question kind of went to how can we incorporate an effective solution with a reliable one? And in order for it to be reliable, it had to be with you at all times. So when we started thinking about it like that, we realized that in your rehabilitation period, you're going to always have your crutch with you. So if we could find a way to integrate that elevation effectiveness with the reliability of the crutch, we'd have a good product.
Right. So that led us to do some market research, and we found that there are crutches that had been made to serve alternative purposes outside of crutching, such as one that has an integrated chair, one that has kind of a collapsible feature, but none of them work to solve this problem of maintaining leg elevation. So as we've said, patients who rely on crutches for mobility often struggle to find convenient ways to elevate their leg while seated or resting. And current crutches provide support for walking, but don't easily adapt to that need for leg elevation, which is, like we said, critical for reducing swelling and pain. So the challenge was to design a crutch that seamlessly transformed from the crutch mode to a leg elevation mode with minimal effort for the patient. And so here we have some of our early prototypes. Starting from the left, we had a dual crutch system that allowed for elevation of the patient's leg that you can see in the center there. But the patient's leg stability was compromised due to the base and sling and portability, ease of use. And so we had to transition to kind of a different prototype design. We then looked at some cane models, and we created a forearm crutch with a tripod device to allow for elevation. And while this version was stable due to that tripod, it did not allow for the optimal mobility and use as a crutch that our patients needed. So we returned then to the standard axillary crutch, which you see on the photo third from the left. And we added a platform here that stuck out horizontally to allow for the leg elevation. And once again, this allowed for mobility because of the axillary crutch version and elevation, but sacrificed stability due to the small surface area of the base. And so these early prototypes led us to our current version of the heel-up crutch. And this innovative design incorporates a telescoping tripod that is lightweight, durable, and stable, allowing patients to comfortably elevate their leg without needing additional equipment. And this design prioritizes, like we said, the ease of use, stability, and ergonomics to enhance patient mobility and recovery.
Okay, so here is a video of heel up in use. As you can see, the head telescopes down into a fold out system. You can rest your leg on it, and then when you're done, it's as simple as pulling the head back up, clicking it back on, and getting back to what you were doing. All right. So HealUp achieves this by transitioning between these three forms seen on screen. So there's the crutch form where the base is telescoped outwards and the crutch leg is bolted inwards. It does this through a clicking mechanism. This can then fold out with the head going down, getting into the leg rest form, and then it can then be folded in again to get in a more compact, easier to transport form. Here's just a close-up of this transition so that it's a little bit more understandable. Again, pull out, push down, and then fold back in. One solution that we had to find using this system was how to still maintain like changing of height while still having the pull-out system. Typically, you would just go select a pin and then keep it stagnant. But to have the telescoping feature work, we needed to make it so that the pin itself pulls out, goes up, and comes back in so that when you pull it up, it clicks into the same place every time. And so here is a view of it in its compact form. You can see a typical axillary crutch on the side and it in its compact form next to it. And someone using it, it's much easier to take around. Took it on the bus on the way here. Much easier to transport around. Right. And that's HealUp.
And thanks again to all of our collaborators at Jefferson main Center City campus and East Falls, as well as folks here at Delve that helped us a lot throughout our entire time here at Jefferson, at JeffSolves in the summer and during our SI track work. Thanks again.
All right, audience questions. Who wants to go? Somebody's got to have a question. Go for it.
Hi, great presentation. I just have a concern, but I do like the ergonomics of the crutch and you being able to carry it on the bus. But when you look at a crutch and its design right now in traditional sense is like an inverted triangle, right? So you get a lot of stability that way. So when you're looking at somebody who may use this crutch, who may be 70, 80, have a different sort of stability versus, your problem that you had, is significantly there's physical differences. So how do you compensate for the stability of it just being a singular pole and it's getting gradually, the pole that has different circumferences that may not be as stable as a traditional crutch? So how do you get over that problem and that fear of an older adult who may need this?
So that isn't a market that we've currently looked into yet, but theoretically what we could do is potentially have the head of the crutch rest on the larger fold-out mechanism and then have it go, like you were saying, from larger to smaller to get that stability you're asking for. Does that answer? Mm-hmm.
I mean, I don't know if I fully understand what you were saying, but I just know one of the products that we did look into while we were researching was the mobile legs, and that does just have like one like it's just like one pole, and it's used like for people who are usually like athletes and all that. So it does have like that has a stability. So I guess we could try to get some inspiration and figure out how that would work.
The way in which you adjust the telescopic, from larger to smaller, and it gets to your arm, because that is where the instability.
I see what you're saying.
Right, as a traditional crutch is like an inverted triangle. So that is, that gives you a lot of stability from the shoulder down.
Yeah, that's definitely something we could look into moving forward.
All right, any other questions? And any questions online, you can use the Q&A function and we're monitoring that as well.
Very nice presentation. Very interesting idea. 2 questions. how much does this crutch weigh compared to a standard crutch? Second question, what's the fabric? I'm just curious about comfort and whether you thought about alternate fabrics, padded fabrics.
Who wants it?
So as the weight, we haven't done a weight comparison. It is noticeably lighter, but I can't give you an exact number. Enough to carry around.
Lighter than standard crutch?
In my experience, or at least there's less like it's closer to me, I guess. So it's not as cumbersome to take around. I could reasonably see that it is heavier. And as to the fabric, we haven't looked too much into material yet, but we are looking into using a lattice structure to make sure that the fold is consistent when it is going back into its compact form, though we don't know specifically what that looks like yet. That's kind of like an unknown at the moment.
All right, we got another one back here.
So, hi, my background is finance, so I wanted to know, one, were you given a budget to do projects? One, and I guess we'll see with the next project if it was the same, like the same amount of budget, or you just kind of thought about any kind of like costs that would go into producing this?
I can start to answer that question on behalf of the program. We do actually tend to approach all of our design in this program from an accessible standpoint, right? So we try to keep things while they're bespoke. Anything that's getting a little too complex or over featured, we tend to, I guess, heavily suggest to go away from it, right? So I'll let these guys speak a little bit more to like how they decided to feature the kind of feature level of where they are now, which will ultimately come into the cost analysis. But as much as I'd like to, we do not get these products to the point where we can do like a formal, like full cost analysis on them. But anybody want to comment on the features?
So at least when we were building the first prototype we had, we just went to Home Depot and just got some electrical conduits. They weren't that expensive. I can't remember how much, but I don't think, yeah, it was like, he's like $16. It wasn't that much. And I don't know how much it was for the printing, like how much the material cost, but it wasn't that much either. How much was our budget again in total for the summer? Yeah. Oh, okay. Yeah. But we had enough to make like this. So it wasn't that expensive to make.
Yeah, and generally speaking, from a materials standpoint, we focused more on the mechanics than say nailing down what is going to be producing those mechanics. Because if the thing doesn't work, we can't make it work with a material. And so we just got to the point where we made it work. Again, in the future, if we were to continue this forward, we would try and delve deeper into those nitty-gritty details.
How about the market analysis? Right, so you looked at basically like the cheapest possible crutch,
Mhm.
like the Lamborghini crutches,
Mhm.
right? And you kind of design squarely in the middle.
Mhm.
Right?
Yeah, so we are definitely more in like the mobile legs level, and that's like a mid-level, like $300-$200 crutch. Yeah, it's just a higher end crutch. We're not trying to make this super inaccessible to like everyone, but we're definitely probably aiming more towards like the people who need their leg to function at a high level. So say like an athlete, college athlete, just that kind of area. This isn't something that like your mom or dad breaks your leg and they go to Walmart and get one of these. It's a, you could, we're not going to say like, no, you can't buy it. It just makes sense for the feature set that we have at the moment to kind of get to that level.
Right, we got a question online. You have a comment?
No,
Okay.
okay. Sorry.
All right, question online is, okay, this is from Scott. Great presentation. Did you stress test the crutch? And were there any inadvertent changes in adjustment settings? So that's an interesting question, right? So remember when we were like first approaching crutches and how terrible standard crutch is to adjust? What are your thoughts on the adjustment of your crutch?
So we did do a while ago a test on how the latch out, pull up and then latch back in feature felt. It was interesting compared to a normal crutch, because the normal crutch is a little bit more frustrating to adjust, where you have to go up, clip, it clips back in, and you have to like fiddle with your hands. Whereas this, it's kind of like a 3-step system. So definitely probably takes a little bit longer, but it's also probably a little bit more of a smooth transition, I would say. Would you agree with that? Or
Yeah, I would say like with the normal crutch, you usually only have to adjust it. We were talking to a PT about this only once, so you'll get your hand height to get to the right level, and then you just adjust the bottom piece to like get it to your height. So that is only like one time you'd have to adjust it, as opposed to this where you would have to adjust it every time you are elevating your leg. But I feel like and like the features you get with this kind of just outweigh like that. So it is a little bit more steps, but it just comes with the features.
And I think the other part of the question was a stress test. We didn't do.
But it's
Okay.
more about like, have you considered what happens if
Okay.
adjusting, right? Like,
I see. I see. Okay.
Thank you very much for all the questions. Another round of applause for the Heal Up team. All right. Thank you, guys. And after, for everybody who's in the room, you get to play with their prototypes after the event, which I highly recommend. I already have broken a few of their prototypes, so it's part of the process. Okay. Yes, exactly. Okay, let's give me 1 second. Well, did I just do what I didn't want to do? Probably. Yeah, if you want to bring something into the screen, you should put it over here. Oh, that's right. Just bear with us as they bring a toilet into scene. Yes, that is perfect. I love it. Wonderful. All right. So next up, we have Team Commodore. Yes, you can clap. Please clap. There we go. All right. Who's going? Who's going first? Who's going first?
Hi, everyone. We're the Commodore team, and we are really excited to present to you a new era of bedside toileting.
Meet Cindy. She's 40 years old, lives in Philadelphia, works as a medical assistant, plays recreational soccer, and has a very active social life. Between busy moments, she uses the bathroom 6 to 7 times per day, as most of us do. It was never anything that she gave much thought. One day while she was out walking her dog, she was tragically hit by a car. She was rushed to the hospital and unfortunately underwent an above-the-knee amputation. Among the many things Cindy had to relearn how to do after her amputation, one of them was toileting. In the hospital, she used a bedpan for 1 month while she was immobilized in bed. She then spent 2 months in a rehab facility where she began adjusting to her new life in a wheelchair. After extended use of the bedpan, she was so relieved to finally start learning how to use a bedside commode. With the help of an occupational therapist, she learned how to use the commode, sometimes by the bedside and sometimes over the toilet.
When she was finally ready to go home, Cindy was discharged from rehab with a standard issue commode, which was covered by her insurance. Cindy's story is one of thousands of traumatic amputation stories every year. In many cases, people are resigned to using a bedside commode for the rest of their lives. We spoke with commode users like Cindy, as well as with their caregivers and healthcare providers, and identified 6 key areas where current commodes fall short. Stability. Many commode users have to position their commode against a wall to keep it from tipping backwards and can't trust it to support their body weight, especially during a transfer. Accessibility. Most commodes have permanent armrests that prevent users from transferring from the side. Even upgraded commodes with retractable armrests don't give users the support they need during transferring. Comfort. Most commodes are made with cheap and even sharp materials. These are especially harmful as many users already have higher risk for skin wounds. Wiping. A tiny seat and narrow armrests make it challenging for users and caregivers to even reach where they need to wipe. No built-in toilet paper storage means users often have to shift their weight to even reach the toilet paper. Maintenance. The bucket comes with a cheap, loose-fitting lid that offers almost no security. Aesthetics and ultimately dignity. Bedside commodes look like cheap medical devices that do not belong in a person's home. Some users are embarrassed to invite company over and often feel compelled to cover it to keep it out of sight.
In just seconds, Cindy's entire life changed. She knew that her issued commode would not be a sufficient solution over the decades to come. With the help of her outpatient OT, Cindy began searching for new ways to make toileting easier. What were her options? Cindy dreamed maybe one day she could renovate her bathroom so she could wheel to the toilet whenever she needed. But like most people, Cindy didn't have thousands of dollars sitting around, especially after months of expensive medical care. Cindy learned that if she needed particular additional features, such as a cushioned seat or a retractable arm, her occupational therapist could help arrange for her insurance to pay for it, but eligibility wasn't a given. And even if Cindy did qualify, these options still presented many of the same issues with the commode Cindy already had. Another option Cindy found is that she could spend a few $100s and buy a commode online. But as before, the available options only offered modest improvements over the status quo and often at the cost of other functionalities. Her occupational therapist also couldn't recommend any of these since she was unfamiliar with them and wasn't sure how they would perform. Stories like Cindy's make it clear that commodes that are good enough simply aren't enough. People with mobility impairments need better options. It's time for a paradigm shift. Home healthcare products must evolve beyond the bare minimum to embrace safety, comfort, and dignity.
So, introducing Commodore, a reimagined bedside commode that changes the game in terms of safety, comfort, and dignity during bedside toileting. It's the first bedside commode designed with the user in mind. We integrated ergonomics, smooth surfaces, customizable height, adjustable handles, and a modern look into a commode that addresses each user pain point. The adjustable and fully retractable armrests and the large seat side platform help users transfer safely and independently. We brought back the feel of a normal toilet with a single piece pinch point free seat to prevent skin wounds and improve comfort. We added front and back seat cutouts to give users better access for wiping while accommodating for male anatomy. We also incorporated a hand pump bidet to make cleaning a breeze that eliminates the risks and inconveniences associated with wiping for both users and caregivers. We've added toilet paper holder and a seat side platform so users and caregivers have the materials, space, and access they need for wiping. Commodore features a sealable lid on the bucket that ensures spill-proof disposal. When not in use, the lid is stowed underneath the seat where it is safe from becoming possibly contaminated. Height is adjusted by pulling the handles outwards and lifting the user's desired height. The armrest arrays once the lid is open. Looking inside, we can see the self-contained bidet system operated with a simple pump action. And for cleaning, the lid is stored under the seat and placed on the bucket before removal.
Commodore gives users a sense of empowerment, less reliance on caregivers, and a better quality of life. The beautiful design integrates into modern home settings and eliminates the stigma associated with traditional healthcare equipment. We showed our design to stakeholders and have received overwhelming positive feedback. Users, caregivers, and healthcare providers have shared that Commodore is unlike any other commode on the market. It solves nearly every issue they have experienced, and they can't wait to buy one. We envision Commodore as the new solution of choice for all long-term bedside commode users. These include lower extremity amputees like Cindy, or the hundreds of thousands of people who've experienced a spinal cord injury, a traumatic brain injury, or a stroke. Our pilot design is geared specifically towards people with a trauma-related lower extremity amputation. People with other conditions often have varied functional limitations and unpredictable life expectancies, but users with a trauma-related lower extremity amputation often have full function of their upper extremities and their other lower extremity, and they have relatively time-stable health. These users also represent a small but significant pilot population. Our estimates suggest that there are about 6,000 new trauma-related lower extremity amputees each year. For all these reasons, we expect that users with a trauma-related lower extremity amputation will have the most success using the first generation of our product. In addition to our aesthetic design, we've also finished our first round of proof of concept prototyping. We've validated our dimensional assumptions, platform, feel and design, and handle functionality. This first prototype also validated that Commodore achieves the baseline stability we expected.
In our next prototype, we intend to test options to solidify stability and validate bidet functionality. We will also explore options for securing intellectual property, potentially via a new and novel waste management and collection system.
Once we finalize our design and solidified our IP, we plan to design for manufacturing so we can make Commodore available to thousands of people who need it.
It's time to finally bring dignity to bedside toileting. Join us on this journey. We can introduce ourselves. I'm Jacob Shteingart. I'm a second-year medical student at Sidney Kimmel Medical College.
I'm Emma Tam. I'm also a second-year medical student at SKMC.
I'm Jess Smith. I'm also a second-year medical student.
I'm Anderson Eng. I'm a second-year master's in textile engineering student in East Falls.
And I'm Joseph Braverman. I'm a senior industrial design student at East Falls.
And thank you to the many, many people who have contributed, including everyone involved in JeffSolves for supporting us, sometimes in ways that were comfortable and sometimes in ways that were uncomfortable, but all important. Thank you to Delve Advisors, Tom and Patrick, and thank you to a lot of the staff at Moss McGee, and also all the caregivers and users who shared their experiences, who are not named for privacy purposes, but who really drove forward our design. Thank you.
All right, questions? No, everybody's got to have questions about this one. All right, raise them high in the back. Okay, here you go. Please use the mic.
First of all, great job, guys. I think your design looks really great and it shows the amount of effort that you put in, so you should be proud. I had a question. You had pointed out that two of the issues that you see with the current toilets on the market was that the cost coupled with unknown recognition by the PTs made it hard for them to get sort of market traction. And so I was wondering if you thought about where you fell in the cost line and how you plan to get market recognition and acceptance by the PTs.
I think the other aspect of why those commodes fall short is because there's many things that they don't address. They kind of have this plastic veneer, which makes it look like maybe it has a lot of the features that we're proposing, but actually they don't. So just for starters, the armrest is a huge feature because it helps users transfer from the side. So armrests have to be really sturdy so a user can grab onto it from any direction and rely on it, but they also have to be retractable so users can transfer. Now, the models that we've seen out there, their armrests are either not as reliable or not retractable in the same way. So that's just one example. So I really think the differentiator is not the cost and not the recognition, but the features and the functionality.
What was the biggest roadblock or challenge you guys faced, and how did you work around it?
Excuse me, can you ask a longer question so I can do a little less running? Sorry, just kidding. What was it? I already forgot the question. Sorry, I made a joke. I should have made it a bad joke. Well, biggest challenge and roadblock.
Yeah, so one of our big challenges was narrowing in on a population, because originally we wanted to create a commode that would be like the best commode for every user, but then we realized the elderly population is so different from someone with a lower extremity amputation. And so once we honed in on one population, it got a little easier, but it was tough to reconcile getting rid of some features that we originally wanted for the elderly in focusing on this population. But since this is just like the first generation, we plan to hopefully expand and grow into more populations from this.
Don't forget, everybody online, you can ask questions too. Any other questions in the room?
This is just as much a question to you, Robert, as it is to the students. But to be clear, these are academic projects which may or may not go forward into commercial development, correct?
Correct.
Correct. Have you guys decided? You sound like you're really interested to move this forward. How do you make that decision?
That's a hard question. How do you decide whether you want to spend the next 5 years of your life designing a toilet for commercialization?
I mean, I guess I'll answer by giving a non-answer, which is to say we have not quite decided yet. Our team is multidisciplinary and we're pulled in a bunch of different directions. But I will say it would be really hard to say goodbye to this project because we put so much into it. So stay tuned for that, for our path forward. Do you want to add anything?
Aside from what we decide to do, I think practically there are decisions to be made about, obviously this idea would help a lot of people. There's no question. And I think that's what motivates us. That's what makes us excited about it. But we also live in a world where there are more factors at play. And so the path forward with all of those factors, including how it would be manufactured and by whom and where that money would come from and whether we would get any money out of it as people with, essentially no money to put in and no experience in manufacturing. That's a whole different conversation. That's something I think we've all been struggling with, and understanding what's the best strategy moving forward here.
And I think we'll have time for one more question after that. But I do want to mention and kind of make a pitch for the scholarly inquiry design program, which is part of the scholarly inquiry program at Sidney Kimmel Medical College. It's extremely unique in that students are kind of given this protected time to explore a particular area of interest that is important to them. And in the case of our medical students and the students who have joined JeffSolves, they decide to pursue design. So while the program of JeffSolves is this intensive summer program, their work generally will continue throughout their entire 4 years of medical school. It becomes kind of part of their scholarly work. And then for the designers, I think I've never met a designer and always designing. So, you know, kind of everybody comes and goes in and out of these projects during their academic time. And yes, we do hope that these projects will go somewhere or reach the real world eventually. But really, like, I think the real value is the experience that we see our students going through as they learn kind of how to design and how to solve challenges. So one more question, if you remember. Okay, so we got one online question. We got a couple, but I only got time for one. Great presentation. How does a patient in bed, once in a sitting position, easily open the lid to get the armrest to go up so they can use it as a support to get in? Is there a remote control or some other way to control it? Who wants to speculate that solution?
I can do a little speculation. Remote control would be fun, but at the moment we anticipate there'd be some form of mechanical option that would a university would manually extend those armrests once the lid was open, and then they would lock in place, similar to how the headrest on your car seat would work, which we believe would be a similar option. Was there more? Anything else?
To the previous question, if anybody's interested in doing a good thing for the world and has experience in manufacturing, I think we'd be really happy to work with you.
That's a fantastic way to end. A round of applause for the Commodore team. Thank you. The other thing I'll mention that's really special about this program is we collaborate very closely with our partners in the Office of Transfer. So all of these concepts get evaluated for any intellectual property that can be secured, and the university works with our students on when it's the right time to file patents, we will, which is, I think, really, really special and part of the experience. All right, before we finish up, I just want to invite real quick our special guest of the evening, Provost of Thomas Jefferson University. I know come on, you're making a face. Yes, you're our special guest. Provost of Thomas Jefferson University, Dr. Matt Baker.
Thank you so much, Rob. It's great to be a special guest. I will, and today, you know, I work on both campuses. So I spend 3 days a week in Center City at Hampton Walnut and 2 days a week in East Falls. And it gives me a real appreciation for what you're doing, because we're working on both sides of Kelly Drive. And I will be going home to Bucks County, where I will not be a special guest in my home. They're almost guaranteed on, but I just love this, and I read this every year, read a lot of reasons. One of it really transdisciplinary. It's helping people to think differently. I was trained, went through my life, and very small, right? And where I go, first with research, then practice, geriatric, I read about like kind of careful little box of life. It wasn't scholar, there was a lot of problems. Solving because I wasn't studying from there. Way. And I appreciated that, not by working in the hospital or the office where I worked. And I got a chance to do 3 months of home health visit. And I realized their world was much different than the artificial world that I lived in. And then I went into being a healthcare administrator, fun job, trying to figure out how Medicare pays for this stuff, right? And then moving on to education. The cool part about this is you're solving real problems that are there, that are going to help people's lives. just by thinking of things in a very different way. I mean, there's so much empathy. You have to just try to figure out what is their basic issues by, learning that, figuring out a solution that will work for people, that is centered on human factors and patient-centered care. And you're going to change the world with this stuff. I mean, you don't think you're going to change the world with a crutch or a toilet, but having somebody who had a spinal cord injury and had to use a commode, and taking care of sick and elderly and hospice parents at home. I have several commodes in my garage, and they weren't good. And I've used crutches an enormous amount of times from injuries. So I think I'm just always amazed at this. And I thank the students. I thank Delve. I certainly thank Rob at Barry Ellen for doing this. And this is just fabulous. Thank you.
All right. Thank you, Dr. Baker, for those great comments. It is an incredible honor to get to do this program every year. I feel really special to have, even just a moment in time with these really talented students to help them along their journey. So join me in giving them another round of applause. For the people in the room, come check out their prototypes. And for everybody online, thank you so much for joining us. We'll see you next year.